Record. Right. So, welcome everybody to the Shoreham Network. And tonight's Shoreham Network is centered around the Harbour View. Oh, I've started again, isn't it? The Ada Health Partnership. And to talk about it and life as a doctor or a GP in the last 14 months is Dr. Mark O'Halloran. So, welcome.
Hello, nice to see you. Hello, everyone. First of all, I apologise. I'm doing this from home, so if there are any children barging in or whatever else, then such is life. I'm afraid that's how things are nowadays. I'll try and keep my presentation fairly brief and allow time for questions. I'm sure there's all sorts of things that we could talk about. I've chosen just to I'll just introduce myself and I'll introduce the doctor's surgeries and talk a little bit about that. And then I've just chosen to talk you through the last year since kind of February, March 2020. So if you're interested then, and I assume you are because that's why you're here, I guess, then you'll get some insight into what life has been like over the last year or so. For me, I'll try and tell you a little bit about how it's affected some of the staff as well, but it's going to inevitably be a bit of a personal view on things. I'll just get going in that case. I'm going to drop out, so you're going to miss my face, which I'm sure you'll survive somehow, and instead I'll just have the presentation, and then when we come back to the questions, I'll put us all back up again. Now let's just see if we can get this working. There we go. Can you see the presentation?
We can indeed.
Fantastic. Right. So we'll go straight on into who am I. So I'm Mark Halloran, Dr. Halloran, one of the GPs in this thing which we're currently calling Ada Health Partnership, which is the partnership of the three big practices in Shoreham. So that's Manor Practice, Northbourne and Harbour View, which are all working together now. I've been a GP partner at Harbour View, so that's the Shoreham Health Centre now, for around about 12 years. And I'm currently mainly based at Northbourne. And that's happened this year since the vaccinations have happened. I've taken a lead on the vaccinations, and last year for the health centre and also for Downsway, which is the other the branch surgery I didn't mention, which is up in North Southwick. I've been the COVID lead, and I've also this thing, I've put a couple of other things. I'm a trainer, so I train other GPs, and I'm also something called a PCN CD, which stands for Primary Care Network Clinical Director. So that's it's maybe taking a slightly bigger view of the work we do, not just as a general practice, but also thinking about linking in with some of the other services out there, such as the district nurses, who in the old days used to be part of a GP practice, but ever since I qualified and for quite a while before, they've been quite separate. So there's quite a lot of other NHS organisations. The NHS is never quite as simple as you would want it to be, I don't think. So that's me, and that's me having, I think, the second vaccination in the area, so it'd be right at the beginning of January, and being given that by Dr. Howard, Simon Howard, whose birthday it was that day, who had the first vaccination. That was his birthday treat to get his first vaccine. Just for those of you that don't know, I thought I'd show you some pictures of the different sites. So this is a picture of Northbourne surgery, which is on the Upper Shoreham Road next to Southlands Hospital. We've got the Manor Practice, which is next to Southwick Library. So that building, as you see it, the slightly higher part is the GP surgery, and the slightly lower part on the other wing, as it were, is Southwick Library, and that's quite close to Southwick town centre, Shoreham Health Centre. And this is a slightly nostalgic picture of Shoreham Health Centre from when it used to have Burscroft attached to it, which is now gone, and instead there's a large empty space. And I haven't explicitly put anything in here about the redevelopment of Shoreham Health Centre, but I'm happy to talk about that if there are any questions about where that's heading, if it's heading anywhere. I'm happy because I've been involved in that a little bit as well, quite a lot as well. And then last but not least, this is the Downsway site, which is, as I say, just in North Southwick. So if you know where Tops Tiles is as you come along the Upper Shoreham Road, actually heading away from Shoreham, you would turn left just after that at the traffic lights, and one of those roads is Downsway, and this is a converted bungalow, which doesn't look very big. There are 3 consulting rooms, 3 decent sized consulting rooms, and a couple of smaller ones there. It's actually quite a nice little site. So if it's okay now, what I'm going to do is I'm going to talk you through my year. So we'll start off right at the beginning. So back in February and March last year. So really, I've tried to put it into phases, which I think there probably were, and I've tried to highlight some of the issues. If I was to go through everything that was involved, we'd be here until Sunday morning, I think. So I'll try and kind of give some kind of broad themes to it. I think, like everyone else, we went through the biggest change during that time period that they've ever been through in their lives. And for general practice, it was interesting seeing how we all personally responded. It was interesting looking at the organisation, and also how the wider NHS responded. Some of the things that we have done over the last year and that were introduced very quickly in particularly in March and early April were very much led and mandated actually by the central NHS leadership, and in some ways that's a good thing. The NHS has a very centralised management structure currently, so there were lots of things that were put into place very quickly, but some of the things that I think have frustrated patients at times have also been things that we don't necessarily have local control over. But at that point in time, it was a time when I was every evening, morning, looking at updates that were coming through about what we should and shouldn't be doing, how we should be changing things. And that carried on for a few months, really, where it was, I'm sure everyone else was watching the news all the time. I actually didn't have a chance to watch the news very much because I was so overwhelmed by the amount of updates and advice on the science behind COVID, but also the organisational steps that we had to put in to protect our patients at that point in time. And really every single process that we had to evaluate how we would do it, or if we were going to do it through the lockdown. So obviously the change between February, when we were still seeing patients entirely normally, through to May, when we were trying to do as much as possible by phone and by video and by text, was absolutely huge. And some things we knew we shouldn't be bringing patients in. So some things, it was obvious that the risks to patients of coming into the surgery were completely outweighing the benefits. And there were other things where it was a more nuanced decision as to what the right thing to do was in terms of patient safety. And then there was also quite a lot of the emotional balancing as well, because there were things that objectively, in terms of someone's health, may not seem that important from a doctor's perspective, but some patients hold them very dear. And so there were some difficult decisions to be made. As I say, some of it was nationally mandated, and some of it we had to apply our own nuance to it. Second thing I popped on the list was the IT issues. The picture there hopefully demonstrates a little bit about our quality of technology at the beginning. So that was an attempt to have a video chat. We only managed to get one person on each screen using I think maybe one of them was using MS Teams, one of them was using Zoom, and one of them using FaceTime. And we just put them all next to each other and they could still hear each other, but it's not the best way of running a meeting. But we've got that sorted now. So I think everyone's now completely kind of on top of the technology, but it certainly took a while. The NHS wasn't ready, I don't think, certainly not from a technological point of view. But I think there was a lot of ingenuity that went on, a lot of learning. And by May, I think we'd got a lot of solutions in place. What we saw very quickly following the lockdown was a reduced patient inquiries. So there was a time in general practice where, even though I was spending an awful lot of time reading the latest guidance and implementing it, the actual number of patient inquiries dropped very soon after lockdown. I think patients heard the message that the government put out about protecting the NHS, and sometimes that message may not have been the right thing. And I think we recognised it at the time that there was more of a drop-off in patient inquiries than we would have expected. We knew that patients didn't want to go into hospital at that point in time unless they absolutely had to in the first months of the pandemics. And it's been borne out that patients had the right perspective in many ways, because we've seen in the news in the last week that there were lots of infections that occurred in hospitalised patients throughout the course of the last year. So I think it was a difficult decision for patients, and I think lots of patients made a decision to hold on to health problems for longer than they would have done normally themselves before approaching us as GPs, for fear of the fact that we might tell them they needed to go into hospital. And that was a double-edged sword from our point of view. At that time, in between February and May, we had a drop-off in workload at a point in time when we were really busy with the adaptations we were making in practice. But the other perspective of that is those problems that people held on to did come up later. So I'll tell you about some of the other times when things have maybe returned a few months later and with worse problems. And unfortunately, every lockdown has been similar. So we found again, the first few months of this year, they were slightly quieter, and unfortunately now there's a huge amount of workload that we're currently going through at the moment to pick up. Really, if I'm honest, for lots of things that have happened over the whole of the last year or so. Our staffing rates right at the beginning were terrible, because we were being as careful as we possibly could be not to let anyone in with any COVID type symptoms. And that first lockdown was in March and April. There were many people with coughs and colds and just minor illnesses. We didn't actually have anyone who had a confirmed case of COVID at that point in time. But as a result of keeping people at home and not having the IT available at that point in time, we were very low in staffing numbers. And there was a huge amount of anxiety amongst many of our staff about the risks that they were placing themselves in during that first lockdown, when we were all, I think there was a degree of anxiety about what COVID was and how it could be transmitted. And I think particularly for our receptionist, it was a shock, I think, to quite a lot of them, even though we know that we're talking to ill people every day and we're talking to infectious people every day. When you're faced with a global pandemic, I think it hit some of our receptionists in particular, and some of the doctors and nurses, to be fair, quite hard, that they were putting themselves at risk. So we had to work quite hard to make them feel safe at work. And we did, again, we reorganised quite a lot of stuff so that some of the more vulnerable staff members were kept away from patients entirely during that time. So we had to take quite a lot of people and we moved them to a building, to the Downsway building, and didn't have any patients into that building for around about 4 or 5 months. And they were only doing telephone work, which helped to a certain extent with that anxiety. Thinking about the kind of the next steps, I've got a picture of me on my birthday, which is the 5th of June. We were starting to start things back up again. We knew that there was a lot of work that we would need to catch up on. And we were starting to see a few COVID cases, and we set up what we call a hot hub, which was a daily clinic every day, separate from all of our other services, with a separate entrance, with separate doctors and receptionists that didn't engage with any other staff or patients during the day, so we could get a very clear line between the COVID patients that we were seeing and the rest of our work. Again, partly about protecting our staff, but an awful lot about protecting the asymptomatic patients, so patients who didn't have any symptoms of COVID. Of course, we couldn't be sure at that point in time because we didn't have the lateral flow tests or the PCR tests availability that we have now. But I think we set up a very effective system. I'm proud of what we did. To my knowledge, there's been no evidence of any transmission within any of our sites. So we've had plenty of patients who've been diagnosed with COVID, and we have had staff members who have had COVID. But to my knowledge, none of those have happened at work. So when people have caught it, it has been in relation to their lives outside of work. We did some weekend work, which we hadn't previously done. So I was working kind of fairly full week, and then at the weekend I'd be providing care for our care homes on the phone, again not in person during the weekends, but on call from 8 in the morning till 10 at night, Saturday and a Sunday, and then going into the following week. Again, it was quite hard work. And then I put there was that time, and you'll probably remember this phrase of the new normal. So we were having quite a lot of discussions about how can we do everything? How can we get the patient seen whilst maintaining social distancing, whilst cleaning everything? We're still struggling to a certain extent with how do we manage the volume of work that is there whilst keeping everyone safe. And there is a tension, particularly around premises, actually. And at the moment, there's the vaccination program as well on top of that, which I'll come to. So, as you might have noticed from the way I was talking earlier, in September and through to December, we started seeing lots of problems that hadn't been raised during the earlier parts of the year. So we were trying to do as much as we possibly could in terms of all of our services, dealing with all the health problems that we could during that time. But I remember particularly a time in kind of October, November, when the kind of the stress on the staff at that point in time was huge. And we could see, as I put that picture there, we could see the cases were rising. And we didn't know what to do about it, to be honest. We knew that we were doing everything that we could. And at that point in time, I think, and throughout this pandemic, it's been obvious that the only thing that's controlled the cases, other than the vaccinations to a certain extent, has been lockdown. And then I think we were struggling, particularly in the run up to Christmas, seeing the massive rise in cases that occurred in Shoreham and Southwick throughout the latter part of December, and then it continued into January, which stemmed, I think, an awful lot around secondary schools, and then secondary school children bringing the cases out into their families and the wider community over Christmas. And what started off as being young people with the Kent variant, we have to assume, turned into quite a lot of older people. Yeah, I think we were very grateful that the lockdown was imposed as it was at that point in time, because that kind of coming into January was very hard. I've also popped down the merger there in terms of the 3 practices. And again, if anyone's got any questions, I'm happy to talk about that. But as I said at the beginning, the 3 practices, Northbourne Manor and Harborview at Shoreham Health Centre, are all working together closely. And that really kind of kicked in around that time as well. So in terms of some of the legal work that we had to do to kind of form as one business, which was an added pressure that we didn't want, but it had been planned for quite a while. So there wasn't going to be a better time in terms of doing that. So that was one more thing on top of everything else. Now, the next stage, we're almost finished, and then I'll have a rest from my own voice for a little bit. January into March. So it felt at the beginning of January, with the vaccines coming through, like it really was a race against time for getting these vaccines out there. In the other slides, I've chosen individual pictures to put alongside it. And this one, I looked at January and I realized that I really, on my phone, I hadn't taken a picture of anything else. So there's pictures of boxes full of vials there. There's pictures of people in the clinics. There's pictures of people taking the vaccine out to care homes. There's pictures of the car park, because a large part of this has been the logistics about how do we get enough people through the centre in a way that's, this is mainly at Northbourne, we've been doing the vaccine work. How do we get people through safely with social distancing in place? Because we were terrified, I think, in January that we were trying to do good by delivering the vaccine programme, but the last thing we wanted was for anyone to catch COVID when they came for their vaccination. That would have been a disaster. And we were looking at a time when 1 in 50 people had COVID at that stage in January. So if we were taking through several hundred people in a morning, we were probably going to be seeing at least 1 or 2 people, maybe more, with COVID at that time that would subsequently be diagnosed. They wouldn't have had any symptoms, but they were still going to be a potential risk. So we were being as careful as we could about social distancing and all the rest of it, bearing in mind, obviously, as staff, there's no way you can deliver a vaccine from 2 meters away. We're not allowed to do it like darts, unfortunately. We do have to aim and make sure we hit. So it really felt very pressurized, and it was very, very rewarding work. And I have to say, particularly, I think, thinking about the care homes at that point in time, the evidence was that for every 20 vaccines we delivered in care homes and nursing homes, we'd save a life. And we've got 10 care homes with around about 300 patients in them. So we knew that we were saving lives very quickly by getting those people vaccinated. And I have to say, sadly, we weren't in time for one care home where really the week before we got the vaccines, there was a huge outbreak and quite a lot of their residents did die. And there were 2 other care homes that were on the verge of that had a couple of cases shortly after we vaccinated. And I have to say, I think the vaccines did prevent any large-scale outbreaks in those care homes. And so I think that figure that's quoted of 1 in 20 people, it felt accurate at that point in time. And certainly as a doctor, it's one of the most powerful things I've done, to be able to protect so many people in such a short period of time. And obviously it was also the case for the wider population. But whereas we were vaccinating a lot of the elderly patients who'd been quite good at shielding, it's very tricky for the care homes to manage that with multiple staff coming in and out, and the fact that COVID wasn't necessarily always visible. So I think you can make sure your staff don't come in if they've got a cough or a cold, or fever or whatever else, but some of the cases there were no symptoms, and I think that's been very hard, and I feel very sorry for lots of the care homes that have struggled with this. So it really did that kind of time during January. I've never worked harder than I did then, and 12-hour shifts repeatedly vaccinating. But it was the most rewarding month or so of my life, probably month and a half or 2 months, I think, that time. Things have settled down. So as we got used to the vaccines and understood it more, we've managed to the kind of logistics of the vaccine clinics has been better organised. But as we've gone on, so as lockdown has been reduced and everything's been opening up, we've again hit that problem that we had, I talked about at the end of the kind of autumn time of last year, which is there are a lot of problems that have been saved up during the early months of this year that we're trying to manage at the moment, and it's really tricky managing it alongside the vaccination program. So I put down 23,000. We've actually at Northbourne managed to deliver about 26,000 vaccines so far, and quite a lot of our patients will also have had vaccines at other areas as well. But the majority of vaccines have been delivered at Northbourne by our GPs and our nurses, working extra hours on top of what they normally do. And I think it has led to a degree of burnout. And I don't know if that's a phrase that people are familiar with, but most people in the NHS will be familiar with it. It's the idea of how you can cope as an individual when you're under significant stress and pressure. And we've all had times when, well, I think all of my staff had times when they've struggled to be able to be there emotionally for their patients, and to be able to function as they'd like to at work because of the stress. And it has, I would say, been the opposite of when the public have been vocal in their support. So it's a very strange experience last summer, thinking back to the times when the NHS was being clapped in the streets. That was actually a time of relatively little demand. Patients, as I say, were holding things themselves. And then when everyone stopped clapping was the time when everyone came back and said, well, you haven't looked after me for the last 4 months, I want to be looked after now. And then that kind of delayed wave of inquiries, which I think we're experiencing again at the moment, has made it hard. And it's certainly we've struggled to meet the expectations that we hold for ourselves, let alone what our patients hold for us. So it's been an interesting time, and particularly at the moment trying to manage the vaccination program. I think a lot of our staff are struggling, and it's trying to find a balance to look after the patients who are struggling whilst making sure that our staff are able to do the job because they're well enough as well. And it's tricky, and I don't think there's necessarily an answer for it. But if I'm going to be honest about what's happened to us as an organisation, I think we've done amazing things over this year, but I think it probably has taken its toll on quite a lot of us. And I'm not entirely sure when we're going to get a chance to recover from that, if I'm honest. I think that's the kind of the slightly sad thing at the moment is there's no kind of summer holidays in sight for us at the moment. It feels like at the moment the pressure is going to continue quite a while. I'd like to end on a really positive note. I guess this is probably the main thing. I've just given you a picture of what so these graphs, I'm sure some of you will have been looking at these on the BBC or whatever. The first one shows what we were like in December, where we could just see that peak. starting to rise. And the second one, the scale on the side is quite different. It shows you quite how high that peak, and this is a local view of cases, did rise during that January. But it also shows how well we've done locally in keeping that line flat, and that's going up to the 17th of May. So it's about a week to 10 days out of date at the moment. But certainly I would say that throughout all of this, Ada have, as an area, have done very well in terms of managing social distancing, lockdown, dealing with everything very, very sensibly as a group of patients, as a community. Other than, I think, when the Kent variant came along in December, and as I say, spread through the secondary school and out into the community, and that's that huge spike that you see there in the middle of that graph. And I think when I read the news about the Indian variants in places like Bolton, I feel for the staff there, because I know what it was like to go through that last wave here, and I hope that they're not going through those same things. I would say I think the reason that it won't be like that again is the vaccination programme. And I think in Bolton, whilst they've seen a rise of cases, which is similar to what you see on this graph, I think the number of hospital admissions, the number of patients in ITU and the patients dying, I don't think they're seeing that spike. I think that is all down to the vaccination programme. So I feel very strongly that the huge success that we've had, I think nationally, but also locally with the vaccination programme, is a really powerful thing. And if I had to give one message out to all of you now, it would be to encourage everyone you know who hasn't been vaccinated to come forward and have a vaccine, because I think that is the thing that means we're not going to be repeatedly experiencing the kind of pressures societally, but also from our point of view organisationally, if we can get good uptake. And I have to say, we have had good uptake locally. We're better than many, many other areas, but there are still people that haven't had it in all age groups. And what we're seeing in places like Bolton is that those people are struggling with it, with the new variant there. And I imagine that cases will rise. This flat line that you see on the graph, though, is not going to stay flat forever. And if we can get as many of our population protected as possible, it's worth it for all of us. So I'm sure you've all had your vaccines. If you haven't, that'll be the first topic of conversation I'd like to have with anyone. If there's any skepticism about the vaccines, I'm happy to go through with that, but happy to take questions on absolutely anything you want to. Let me just see if I can bring us back to the main screen. So hopefully we'll be able to see each other again, which would be nice. Hurrah. Is that working?
There you are. Thank you, Mark. That was
lovely.
Good.
Nice to see your face.
Encapsulated the last 14 months perfectly. Thank you so much, and to you and your colleagues for all the work that
That's okay.
It's so appreciated. Hi everybody. There's quite a few of us on this call, about 20. Is there anybody who'd like to ask any questions? I have 3, but I'll let other people in first. So if you're in the chat, or would you like to wave at me? I'm going to change the view so that I can see anybody wave. Oh, look, there you are. Anne, welcome, Anne. Can you take yourself off mute and then have a chat? You're on mute, man.
I've taken it off. Hi, Mark. I've put it in the chat anyway, but slightly related perhaps to the merger, I don't know. Shoreham has significant numbers of new homes. Are you confident that primary care capacity has risen or will be rising to match that?
It's very tricky. I would say that I don't know that primary care capacity even comes close to matching the potential demand we have at the moment. So it's very difficult for me to say, I think that we can match future demand. We're looking at all sorts of ways to improve what we do. There are a limited number of GPs out there, so it's not always possible to recruit new GPs. So we've brought in lots of other professionals over the last few years, and this is happening nationally as well. So we now have several paramedics working across the sites. We have pharmacists. We have these people called social prescribers that are looking at people's health from a kind of wider angle. We're training our receptionists up into roles we call care coordinators, so they can help navigate people around some of the complex areas of the NHS and their health. So we're doing an awful lot, but that may not be enough to always match demand. We're also exploring, and have been exploring for a long time, new premises at Shoreham Health Centre, which we feel is necessary. But that again is a funding issue predominantly. And we don't have the funding, we don't have control of the funding. So it's very much about looking for help from the NHS, but also I think the councils as well. So because that site is a kind of combined site with West Sussex County Council owning the library, Adur District Council owning the green area out the front, we've worked as hard as we can with them, but I don't think they've got much money either. So there are definitely a lot of reasons why we may struggle to match the demand, and probably we are struggling to match the demand. But there are ways of doing things that will help us. So the other thing that we've done a huge amount over this year, and we will continue to do, is well, if we haven't got the space to provide the service during the week, we'll work our weekends to try and make sure that we can provide more care then. So, you know, that's logic, isn't it? That if you've not got enough space, you just have to find ways of doing it. We're working more mornings and into the evenings. So I think quite a lot of people will probably end up having had telephone calls with their GP later on in the evening than they would have done otherwise. And I'm not sure it's necessarily sustainable for our staff, but we'll work on it. So that's a qualified yes. I think housing is really important, and I do think that that we need to build houses particularly for some of the younger families that can't get on the property market. And I wouldn't want to have like a clear picture that I don't think it's a good idea. I think it is a good idea to build new housing. But if there was one thing I could ask, it probably would be for the councils to help us with the infrastructure to support that. In particular, in terms of staff, there's not much that our local councils have control over. But that's probably a national issue.
Does that answer your question, Anne?
Thank you. That's very comprehensive, I have to say.
I can't help it, I'm afraid. If you ask me a question, I'd love to be able to give you a two-sentence answer, but you're going to get somewhere between an essay and a rant. I'm not quite sure what you'll get. No,
it's cool. I mean, traditionally, most of the power in the NHS sits in the centre, doesn't it? And kind of there's not a huge amount but locally to change the global sum or anything. So yeah, I mean, just if us locals could support in any way, you just have to shout, really. I
think it's really tricky. I was thinking that because I assume that someone might kind of mention that this evening, and there isn't an easy thing to do, because what I worry is if I tell you that we're struggling, then some people hear that and they will then respond by saying, oh, I don't want to bother the GP, which is not necessarily the right way of responding to that, because I want to see people who are ill. That's why I'm here. And if you're ill, the last thing I want you to do is to brush important symptoms under the carpet and leave it. It's not good for you, but it's not good for us either when we eventually do have to see you. We'd rather catch things early and get things treated appropriately. So it's a tricky message to give out there. And I struggle with this because I do worry about it. I want you all to come and see your GP when you need to see your GP. That's vitally important. It's hard. There are people out there who probably don't use the NHS as well as they could do. In both ways, people who overuse it and people who underuse it. And each one of us has to take a degree of responsibility for that. So, but if there is anything that I would say that you could do to help the NHS, it is if you can identify there's a member of your family or your friends or anything who works for the NHS at the moment that you know, please support them at the moment, because I suspect quite a lot of the NHS staff are feeling very low, not just in our organisation, but I suspect across the country at the moment, facing what feels like quite a large, I'm not going to say tidal wave maybe of built up work that we need to get on with, and the hospitals are doing their best to crack on with the waiting lists, and we're doing our best to support patients while they wait for those operations. So yeah, just be kind to anyone you know who works for the NHS. That would be a good start, I think.
Thank you.
Kat, you wanted to say something. You've got your little hand up. There you go.
I have. Thank you. Thank you, Jenny. Thank you, Mark, for your presentation. I just wanted to ask, and you just touched upon it there, about the ease of getting new partners in and some of those younger partners. I do remember being on a call about a year ago saying how difficult it was to get young people, doctors in to sign up to be partners. And then just what you're seeing, whether you've seen any impact of like the Brexit exit, you know, qualified doctors leaving, and if you've seen that impact the partnership there at all. Thank you.
So the last point is fairly easy. I don't think we have seen an impact of Brexit in terms of how our staff have been involved. It may be more felt in hospitals or larger employers, but certainly, I mean, certainly there are a few staff with anxieties about it, but it hasn't been a big thing. In terms of the wider point of finding GPs that want to become partners, I mean, everyone may not understand the way that the GP practices work, but just a very brief lesson on it. If you're a GP, you're either a GP partner or you're a salaried GP, by and large, and the partners own part of the business, as it were. So we get paid whatever's left over at the end of the year. Essentially, that's how our salaries are calculated. Whereas our salaried employees get a set amount of money every year, so just you get a salary. Generally, the partners will have a much bigger role in the running of the business, the organising of the business, because it's essentially their business. But it places quite a lot of pressure, and I think particularly taking responsibility for kind of leases on buildings and things like that can feel quite intimidating. So yes, Downs Way, the surgery that I showed you a picture of earlier, that's a building that I individually own part of, to kind of so that we can exist in that. But the other buildings have quite long leases on, and there's a kind of a degree of anxiety that doctors don't necessarily ask for with these things. So we know that we're going to have a stressful life looking after patients, but when we apply for medicine, we don't think we're also going to be small business owners with the kind of worries about all the things that come with being a small, well, it's not even a small business now, particularly with the 3 practices coming together, it's quite a large business. And yeah, most doctors don't really want to do that. That's not what they want. That's one of the advantages of coming together actually as the practices, is that one of our practices really had got down to one partner who was left having to run and take the responsibility for the whole business on her own, and we couldn't let that happen. So with the 3 practices together, we've now got 12 of us who are all partners in it, taking responsibility for the 3 practices. So that kind of, I think, has secured our future to quite a large extent. The risk, if we hadn't done that, was that the one partner that was left would have become sick or stress or whatever, and if they left, then the practice actually closes because there's no one owns the practice. And it would have been terrible, I think, to have had one of our GP practices have to close, and it has happened elsewhere. But we looked at it and we thought about the knock-on the community of it would have been impossible. They're big practices that we've got with, the smallest of the three had 10,500 patients and the largest had 14,500 patients. And there's no way that if one of those closed that the other could absorb those patients, it wouldn't have been viable. So I think the whole of this conversation to say it's been a tricky time for many, many reasons. It has been tricky for a number of years, actually, but we're quite adept at finding solutions as GPs, I think, and we have found all sorts of solutions, and we will continue to. There you go. You got another rant, I'm afraid. Sorry.
I'm going to ask you. I'm sorry, Kat, did you have anything else?
No, that was great. That's a really interesting insight that I hadn't considered about the three coming together. I didn't know that, so that's really interesting. Thank you.
Well, I'm going to take advantage and ask a question myself, one of three, but if everybody would like to unmute themselves if they're not in a noisy background, then you can join in the conversation. Anyway, Mark, has the last year brought about a significant change in how the public interact with the GP surgery for the future? So, I mean, there's been a lot more telephone or video calls, maybe. Is that the way we're going to interact with our GPs in the future?
Yeah, I think inevitably it has done. If I'm honest, we've been doing quite a lot of work by phone for quite a few years anyway. So a lot of patients would have had phone calls. Certainly as a triage step, that was fairly common, that if someone rang up and there weren't appointments, they'd often have a phone call from the GP just to check in and see whether they did need to come in or not. So we've been doing that for a number of years anyway before all of this. The thing that NHS England, so the higher NHS bureaucracy, as it were, insisted on was the video consultations. And I would say that most GPs found those slightly frustrating and not particularly helpful. So I wouldn't envisage that being a huge part of what we offer going forward. I don't think many people found that satisfactory. It's easier just for patients to take a photo of whatever rash or bit of their body they're worried about and then have a chat over the phone. You end up with a better image when someone's had a chance to sit down and actually compose a picture rather than trying to hold their phone in an awkward manner. So yeah, I think phone consultation is absolutely here to stay. I can't imagine that going. I think it has disadvantages. I like seeing people. As a doctor, you get a lot of information just from someone walking into the room that you can't get on the phone. So just seeing the way that someone holds themselves, seeing the way that their face is as they walk in, you learn a lot, and you can't get that by phone. But you can communicate an awful lot by phone too. So I imagine we'll stick with the things that we know work, which is face-to-face consultations and phone consultations. There is more stuff done online, which there are online questionnaires and emails and all sorts of options there. And I think we don't know how that's going to pan out at the moment. I think there's possibilities that may be beneficial, but we also have real concerns that, I'm just going to take a drink before I carry on, that there's a degree of rationing of care that happens, and it's not a nice word, but everyone knows that if you ring up your GP before this, that you might have to wait a week or 2 weeks or even 3 weeks for a GP appointment. And what you find is that people will choose when they need to see a GP and when they don't need to see a GP. And online access, unfettered online access, where anyone can send a query through at any point in time, has led to an awful lot of work, some of which we struggle to see the relevance of. So maybe, I think because people aren't having to speak to a receptionist and all they need to do is just type in an email or whatever, then I'll just send a quick email to the GP, but it doesn't feel like that from our point of view, because we don't deal with anything as a quick thing. We take everything seriously. We have to, it's our role. So I think that if I had to look at the future, I would say I'm not sure there's going to be an awful lot of video consulting. I think there'll be lots of telephone. There'll still be lots of face-to-face. We're doing 50% of our consultations are face-to-face. When you think about the nursing staff and draw that in, almost all of their work is face-to-face. It has to be. I like people coming to the surgery. It's why I do the job. It's why lots of other people do the job. We didn't choose to do this job to be on the end of a phone. We are finding there's some reluctance. Some patients don't particularly want to come down to the surgery, and that might take a little while until people feel fully comfortable again. But I think that's what we're looking at. And what I can't get clear in my mind is how we're going to manage the online side of things in terms of emails and all the rest of it. And I don't know if that's the big thing, where I just don't think there's the workload. So yeah, there we go. That's my thoughts.
Yeah, from just thinking about it now, I was thinking that new technology might sort of save on capacity, but actually no, you get more inquiries, so you don't win, basically. It's a lose-lose.
It's about, general practice is always about trying to pick out the important symptoms from the not so important symptoms. One of my GP colleagues, who's been a GP for a long time, describes a working day in a GP's life as walking through a minefield. Obviously the minefield is not going to explode and hurt you, but it's one of those patients that you've got to pick out the one that's important. So you may see 20 people who have symptoms that they're worried about a cancer that you can clarify it's not, but you've got to pick up the one that is. Yeah. And sometimes it's very subtle things that help you to distinguish between that in terms of a diagnosis. As an example, obviously there's lots of other diagnoses out there, but that's probably the easiest example. And unfortunately, we're always going to have a broadly similar number of diagnoses of cancer across the area. That's going to be a static thing every year, whether there's lockdown, whether there's not lockdown, whether we have online access or whether we don't. And it's about, I think an engineer would call it a signal to noise ratio, in terms of how easily you can identify the abnormal findings. Yeah. So it is tricky. And I think I would like everyone to be able to ask their GP anything that they're worried about. That isn't a service that I think the NHS can provide. So we rely on the common sense and intelligence of our patients to choose when they can identify the things that they think are important. And most people are really good at that. So we want to make sure that everyone has the access to get that. We don't want a digitally savvy young person who's very unlikely to have cancer, but may have many odd symptoms they just want to ask about, to get in the way of an older person who might not have those skills. So we want to make sure that we keep the phone appointments in particular open, which most people can access. There are still people who are hard of hearing and a few other bits and pieces where phones aren't ideal, but most people have got, either they can access it themselves or their family can access it for them. Yeah. So again, you never get a simple answer from me. It's always a long, complicated one. I'm sorry. I'm just going to put the light on because I think I'm getting a bit dark in here with the sun.
Okay. Now, is there anybody else in the gallery who's got a question? Please raise your hand. Right, Ray, you have a question.
Let's go back to the partnership ownership. We read a news item that in London, a quite large range of practices were taken over by an American company. What actually, I was never clear what it meant, but the interest for me was pretty certain it included the practice that we were with when we lived in London, because at that stage, 2 of the doctors there were said to have bought the practice. What does that actually mean? Can you elucidate at all?
What does buying the practice mean? Do you mean?
Yes.
Well, it's interesting. So GP practices are kind of half small businesses and half not. You can't sell a practice for money. There's no, I can't remember what the phrase is, but there isn't, they're not worth any value. So, but when I joined the practice, I had to pay in my own money for the current account. So I put some money in, which is then builds up the money that the practice has, that it pays its staff with. So essentially, my personal finances are then linked in with it. The staff are being paid from my money, and as I say, whatever's left at the end of the year, that's what I get as a salary. Essentially, it's not a salary, that's what I take home. So that there is a degree of investment. There's also, for me, there's a degree of investment in, as I said, I own one of the practice's premises. So I had to pay in, I own it with 2 other doctors, so we each had to pay, I think, £87,000 of our own money to buy the premises from which it operates. So, and obviously you can get mortgages and, you know, all sorts of things to do that. So it's not necessarily that you have to find that money initially, but yes, it is quite complex, and every practice is different in terms of how they operate, particularly in terms of the premises. So out of those 4 premises that I mentioned, the only one that doctors actually own is the Downsway, the bungalow. The other ones, 2 of them are leasehold, and the Shoreham Health Centre, I think we're essentially squatters in Shoreham Health Centre. I don't think there's a lease. I think it's just what we've been there forever. I mean, we still pay money. But I don't know that there's a formal lease there. So it's fascinating, actually, the business side of running a general practice. Slightly intimidating at times, particularly now when I look at turnovers of money in the millions of pounds, which we're talking about, and trying to make sure that's spent as best as it can be for the patients it's not a skill that we're necessarily built with. It doesn't come in our medical training.
It does seem quite extraordinary, really. And certainly in the press cutting that I was referring to, there was a large sum of money mentioned in which the takeover had been 20 million or something, had been done. So presumably a lot of that was connected with premises.
Yes, you can't sell a GP practice. They're not worth, you're not allowed to, basically. So it must have been premises. It's interesting. I like the fact that we're small businesses, because I think, as anyone who's ever run a small business will know, you tend to put your heart and soul into your business if you're running a small business. And I think that that's the joy of general practice, that I work with a group of doctors who we do really is our lives. And I think that works for patients. I think it's the right thing for patients. I don't think patients want doctors or GPs that do it and that it's a vocation. It's not, you know, it's something that should be that important to you. It has changed over time, and there are more and more, there's change in the workforce, so more and more doctors who are trying to look after their families alongside being a doctor, so inevitably there's less full-time GPs out there. That's just how medicine has changed, you know. Even in the 20 odd years since I was at medical school, you know, the number of women GPs has risen hugely, and it's not a bad thing, but it changes the way that general practice looks to a patient quite considerably. And I think again, we find ways of adapting, and there's less continuity now than there used to be. There's people say there's so many doctors at the GP practice, and there are, because most of those doctors are doing maybe half of what a full-time doctor would have done 30 or 40 or 50 years ago. And there's also so much more work to do now than there ever was. So we do need an awful lot of doctors to staff the service. So it's changed a lot. Not, I'm going to say, necessarily for the worse. I think, you know, we do so much more in terms of everyone's health. And obviously the fact that we have a population who are able to live into their 90s quite often. And, you know, we've got a few patients. I've given a vaccine to a 106-year-old during this season. So that we must be doing something right, but it certainly does feel different than it used to be. Right too.
So I now understand more about that. As far as the vaccination routine at North Bourne was concerned, I thought that was wonderfully organised. We both did, and you know, obviously we're off the age where we were early on. Whole thing was excellent, and thank you all very much.
My pleasure. Honestly, it was an absolute, particularly, as I say, that first six weeks or so when I was working, as I say, harder than I ever have done, but it was also by far and away the most rewarding work I've ever done. So yeah, thank you for coming down and getting your vaccine. That's you made me very happy.
Anybody else out there wanting to ask a question, please raise your hand or put something in the chat. Oh, hello, Ian.
Dr. Mark, do you think it's likely that we have to have a booster vaccination every year, the same as we have a flu jab?
I think it's very likely, yes. I have not seen anything to say that anything's certain at the moment, but I'd put some money on there being at least one yearly booster, if not it being a continual thing. If I have my way, we'll get it with the flu jabs. It makes absolute sense. You get one vaccine in one arm, one vaccine in the other arm. And that's an efficient use of time from my perspective. And hopefully it will increase the uptake for the flu jabs as well while we're at it. So there'll be a few people, plenty of people, in fact, who got around to having a coronavirus jab, but never quite got around to the flu jab. So yeah, that's probably how I'd like to see it pan out. There are so many things that have changed during the vaccination program that I don't know that there's any certainty on it at the moment. But yeah, that was my best guess.
Thank you.
Anybody else? Waving hands? No. I've got another quick question. I've actually got another three, but we'll might not ask them all. Has COVID-19 triggered a healthier population in respect to people doing more exercise and taking care of diet and that kind of thing? Have you noticed that yet, or is it?
It's been very split. So there are some people who've done absolutely fantastic things in terms of their physical health, as you say, in terms of exercise and in terms of diet. There are some people with mental health problems who found actually that having more time by themselves at home has been a good thing for their mental health. There were also other people who found that being closer to the fridge and not having to walk to the train station and being on their own has impacted negatively on their physical and mental health. So it's been quite polarizing, I would say. And sometimes the media stories will talk about things like a tsunami of mental health or whatever else. But it's definitely, there's more nuance to that. Some people have done well out of it and some people haven't. And yeah, I wish that I could find a way of trying to help people to shift towards the positive side of things. But I think they're often fairly inbuilt personality traits about people and how they are, that they may be more suited to being by themselves than, you know, introverts and extroverts. So it's often not something that I have as much control over as I'd like as a GP. I think it's often quite ingrained in the individual as to how well they've done during this time.
One of the other things was, have you read that Worthing's going to get a new health hub where the old police station used to be? Are you looking enviously upon that? Or are you
Absolutely. Yes, I mean, I've watched the process from afar with that, and I know that it's taken an awful lot of work to get to the point where they are. I'm not sure if it's still quite over the finishing line. So I'm continue to work locally to see what we can do with the health centre. And there's definitely some hope there that something will happen, but I think it's still a little way off at the moment.
Yeah. How can we help you? I think this is my last question, and I'll ask everybody else as well. I know, but how can we help you to get our new health?
Oh, the new health centre.
Who do we nag?
You're more than welcome to nag any of the elected officials. So particularly, I would say West Sussex County Council. They're probably the elected group with most control over the process, I would say, at the moment. And I'm sure that they will all say that they want it to happen. So there's certainly some benefit in that, but I don't think there's no one that needs convincing, as far as I know, in terms of our elected officials. I think they'll all be in favour of that. I think the tricky thing probably for the council is that when they look at funding something like this, they do have to weigh it up against all of the other projects that they have to deliver on. And whilst selfishly I want the project that I'm involved with to happen, I fully understand that they've got budgets for other important things as well. So they've got to do what's right by the population of West Sussex more broadly. So I don't know. We'll be fine. We'll manage whatever. I guess if if there's any way that if you've got friends who are involved in planning, tell them they could look favourably on it if it does happen. And you're interested in in this kind of aspect of things. It'll be interesting what they do there. They're going to have to build some flats or houses on that site to pay for some of it. I think, because I can't see any other way where it's going to be acceptable. So I mean, I don't think that's a bad thing particularly, but we might have to accept something. Hopefully it won't be too hideous. I'm hoping that it will be fine.
It's in the middle of a conservation area, so it can't be too hideous.
It can't. I hope not.
I wouldn't say the current building's pretty.
It's certainly not. If they could improve on that, couldn't they? And now we've just got empty space where
it did win awards apparently in the 90s.
Did it now?
Yes, when it was first built. Yes. Right.
I mean, it's slightly tricky. It's possible that if you look after buildings like that really well, then they may remain good buildings. But it's quite a tricky one to look after well, I think. And there are problems, I think, with things like the library that hasn't even got a toilet that's accessible to people in it. That you think, I don't know who won awards for building a library without a toilet in it, but I'm not sure they should have received that award.
That's controversial. Right, folks. Anybody else for any questions? Please raise your hands. No, there is nothing there. Right, advertisement. Our next and possibly last for the moment Shoreham Network Zoom will be on the 9th of June, and I'm hoping it's going to be Jez and Zara from across the road from the Pond Road Surgery, the Shoreham Centre. We will be has opened its doors now, and we'll be hoping to welcome more and more people in come June. And an advert for the Shoreham Society AGM. We've taken the difficult decision to actually have a face-to-face AGM this year on the 22nd of June at the Rope Tackle. It is a ticketed event, but the tickets are free. That's so that we can limit numbers and be COVID safe, basically. So if you can't make the AGM, with an introductory talk by Dan Jenkins, is going to talk about the new yacht club building, which is our newest excitement on the riverside. You can either, we're going to try and live stream it, or those of you who are members, we've sent out the paper so you can either vote by post, you can text, you can phone me, or you can email me. So we've got all bases covered just about there. So without further ado, thank you so much, Mark. This was so much more than I thought it was going to be. So you've made a great contribution to our series of talk. Thank you. So everybody,
It's been lovely to be here. Thank you very much.
Thank you so much, Mark. I'm now going to stop the recording.
Thank you.